So I think a lot of us that go into oncology don't necessarily have to have a a particular life experience, but I did in fact have a life experience that kind of led me into oncology, which was when I was 15 when my younger brother was diagnosed with cancer. And so, we worked through all that, and then, I was young then, but, not necessarily, I knew back then that this is what I wanted to do just based on what we went through. Those types of relationships, those tight bonds are absolutely necessary. I mean, to me, trust, my patients trusting me is absolutely paramount, just because I feel like, if that is lost, then, there's just no way that there can be a smooth relationship. And so I value that highly, trust, my patients trusting me. I'm excited about, about the possibility of using immunotherapies earlier on in this, and possibly even be able to have better outcomes for our patients. So we've been practicing medicine for so long, just kind of almost like a cookie cutter, expecting that one treatment at one dose, is going to help everybody, it's an outdated way of thinking, I think, just based on, and we know that because of previous outcomes. I mean, it'd be nice if everybody had the desired outcome, but we know that's not the case. So I think now having the opportunity of personalized medicine by taking advantage of things like, sequencing our genes and, finding out, and this is just, we're only in our infancy, I think. These were the things that really were clinically not thought of as being, useful even 5-6 years ago. So, but now, we're at a point where we could potentially sequence most of our patients, tumors and genes to take advantage of them. I had an idea that I didn't want to go into academic medicine. I always wanted to do, private practice. But I think what a couple which we've actually, touched upon. So things like, the bonds that I've already created with patients. I just never thought that would be possible in this short period of time. So that has been very important. But also the opportunity for clinical research has also been what's exceeded my expectations so far, because to me that was, in the past, that was what you would go to university settings for, but we don't have to do that anymore. We have a lot of clinical trials here that could really benefit not just the actual participant, but hopefully advance the oncology overall, help other patients.